Let's begin with some encouraging news, and 3 COVID-19 patients have fully recovered and are now discharged. There are 49 others who have also been discharged but are undergoing home care. That's the latest from the Director General of the Ghana Health Service, Dr. Patrick Abwaje, on Ghana's pandemic status. The national cases confirmed so far, however, remain at 204. Let's hear him from a briefing which ended just a while ago.
As of now, we have about 200 cases confirmed across the country. And a total of about 49 patients with COVID-19 have been discharged for home care. As mentioned in the last conference, we have already added 2 more facilities in Greater Accra to provide care because a large number of cases are in Accra. So I'll give you a breakdown of where that is in the Bank of Ghana and the University of Ghana Medical Center. Let me give you a breakdown of what's happening in Ghana East, which is the largest center currently now. Currently, we have 58 people on admission. Yesterday, we admitted 2 new people. There are 3 of them who are getting oxygen, and we are informed that they are getting better. A total of 38 has been discharged for home care, and we are following them on a daily basis with home visits, and they are actively getting better. Ridge Hospital has 4 cases. They are all there, been there between, they've had a case since between 13 and 19 days. We are waiting till the 21st day. As you are reached 21 days, and then you are retested, and if you are negative, then you are discharged.
Now, Director of Public Health at the Ghana Health Service, Dr. Bedusa Akodie, also gave updates on the global cases and those recorded from travels into the country before the lockdown.
The COVID-19 pandemic remains active, and a number of countries have reported confirmed cases. As we speak now, 216 countries and territories have confirmed cases. The case burden keeps increasing, and more than 1 million people have been confirmed globally having had the infection. This includes more than 53,000 deaths, and it's interesting, and I'm happy to say that more than 211,000 people have recovered. This is the global picture. Here in Ghana, as at last night, midnight of yesterday, the 2nd April 2020, Ghana has confirmed a total of 204 cases, and this includes 5 deaths. These cases have been confirmed from 5 regions of the country, and the regions are Greater Accra, Ashanti, Upper West, Northern, and Eastern region. In summary, the total confirmed cases are 214 in Ghana. We have a confirmed 115 from the general surveillance system of this country. Out of these, unfortunately, we've lost 5. Among the quarantine travelers, 1,040 of them that are in quarantine here in Accra and in Tamale. We have confirmed 89 cases among these travelers.
Now, here's the Information Minister, Kojo Opon-Nkrumah, with a breakdown and further explanation of the figures in graphics so far.
As part of efforts to help people feel free to not suppress their conditions but engage with health workers, we also need to get people to understand that people can be given supportive treatment and they can recover. That's why it's important to break it down. So for the 204 cases, 3 of them, as has been mentioned, have been discharged because they have recovered. That means that after the treatment and the last test, they tested negative. 49 have been discharged and are home finishing their treatment. Our expectation is that they will be tested, and a good chunk of them, or hopefully all of them, will test negative. And I think, as Doctor mentioned, about 20 of them are due for that final test. So We can all keep our fingers crossed for that. That brings us to about 52 that are out of facilities now and are on their way, hopefully, to full recovery. There's 145 that are currently responding to treatment in various facilities as he gave the details. And please let me give a clarification. In Tamale, for example, though there are 10 persons who tested positive, you'll notice that he mentioned 7 plus 2. That makes 9. Because as I'm sure you are aware, there's one that the security is still trying to locate. So it is important to nuance that one. And then there are 2 who are in critical condition as at this point in time. So
Minority in Parliament is urging government to immediately resolve concerns of medical staff at the Kolebu Teaching Hospital, for which they are threatening to withdraw their service over a coronavirus scare. Minority spokesperson on health, Kwabena Mensah Akando, told a media briefing in Parliament it's shocking that despite repeated assurances by government, frontline medical staff still lack PPEs.
We were shocked to hear yesterday that some medical doctors at Kolebu Teaching Hospital are threatening strike actions. I believe that at this point in time, in this crisis, the least that we want to hear as Ghanaians is to hear that any health professional is threatening a strike action. We have taken time to read through some of their concerns, and we think that they have legitimate concerns that we think government, as a matter of agency, must respond to, because at this point in time, apart from God, they are our saviors. And so we must be able to protect them as much as possible, to have the confidence to protect the citizenry. So some of the issues they raised were about the inadequate PPEs in the system. And we think that they must be fully protected as health professionals before they will be able to save lives. And we are reliably informed that we have some PPEs in the system. So as a matter of urgency, we think that these PPEs must be distributed, especially when we have heard instances where medical doctors and some health professionals are contracting the disease as a result of saving lives. A typical example is the Lekma situation and the Rage Hospital situation. So I think it is legitimate that they call on government to protect them adequately as they fight to protect the citizenry. Again, I think that for some time now, government has been doing a lot of talking, and we think that it must be backed by rare actions. The action is not there. You go to almost every region and health facilities are complaining of PPEs. A typical example is a memo that has leaked out from the Eastern region. In Eastern region, I think maximum 1 facility has been taken from each district, and even the PPE that has been sent to those places are woefully inadequate. And so I think that government, as a matter of agency, must distribute some of these PPEs so that they can get the confidence they deserve to be able to fight this particular disease. Again, they also complain about the flow of information, that sometimes they go beyond 24 hours before they hear that a patient that a medical doctor, a health professional has attended to has tested positive or negative. They are of the opinion that they must be the first people to get information whether a patient has tested negative or positive, so that they will be able to take the necessary precautionary measures. And so the opaque manner in which they are managing information should, at this point in time, be very, very transparent, so that the medical doctors or the front-line health workers will take the necessary precautionary measures. Let me take this opportunity to also commend Corporate Ghana for the donations they have done so far. I appreciate so much.
Joseph Opoku-Gakpo joins us live via Skype from Parliament with more. Now, Joseph, what was the reaction to this call from the minority on the floor?
Well, this is a conversation that's essentially been happening outside Parliament itself. Speaking of the chamber, on the floor itself, nothing relating to COVID-19 has come up. But those on the majority side make the argument that government is putting in place the necessary measures. These are difficult times, and that it will take time for things to smoothen up. And so government deserves all the necessary support that's required in order to be able to help the nation deal with the problem.
Some officials of Parliament, Joseph, have come under criticism from medical staff who say they don't get these PPEs in short supply whilst members of Parliament use them. Has this come up in your conversation with these MPs?
Specifically relating to PPE, what MPs have done is on their own. They say they would procure, get it imported, and go hand over to people in their constituencies. Like someone like Samuel Okudzeto Blakwa has done, as far as I know. But the MPs just make the point that they are supporting as much as they can. Government is supposed to take the front lead in terms of providing the necessary resources. The best that they can do is to probably just add up something little in terms of maybe limited PPEs, probably hand sanitizers, and other motivation that they can give to their health staff, which, according to the MPs, they've been doing.
So, Joseph, take us through the other activities that have come up on the floor.
This morning, the House is approving a loan facility to help with the construction of a harbour at Elmina. And there are a number of other items on the table, including various loan facilities to help provide for a number of hospitals. A little later in the day, two things are expected. You recall that about a month ago, government laid before Parliament a request for a supplementary appropriation as far as the 2019 budget is concerned, because government has spent more than 6.9 billion cedis in the oil sector that they're seeking approval for. That will be debated a little later in the day and probably passed, and the expectation is that the finance minister will be around to guide the House to do that. And additionally, the House is also expecting what is described as the coronavirus alleviation program, the stimulus package that ranging in the region of about 1 billion Ghana cedis in order to support businesses and all. That's also a document that the House is expecting to be laid later in the day for them to deal with throughout the rest of the day and tomorrow, because they're going on an indefinite break by close of business.
Thank you, Joseph Opoku-Gakpo, for bringing us those updates from the floor. We move to other issues. Now, glimpses of hope showed on the faces of head porters at Abuabo Dagomba line in Kumasi as the Ghana COVID-19 private sector fund managers fed them. Many of the young women and girls who live on their daily engagement have been forced out of business as a result of the 2-week lockdown. But thanks to Ghana COVID-19 private sector fund, they have something to smile about. My colleague Ohiming Teria has more in the following report.
Liquid soap with water from the spout of a kettle is poured in the palms of these kids. They wash their hands under supervision of their aunts. On the blind side of their mother, the kids left their makeshift house to play with friends outside. Fuseina instructs them to wash their hands to prevent them from contracting the deadly coronavirus.
They just went out, so they need hand washing.
Hand washing has become a formality for many here who have heard about the disease and education materials in the media. In spite of intensified education, most people here are unaware some people have tested positive to the virus in Ghana. It calls for strict adherence to preventive messages from health professionals. Saharatu Zakari is head porter with very little knowledge of the virus.
You don't know, some diseases, you might shake the person's hand, and I think if you wash it, it will be better.
Do you know how the coronavirus gets into the human body, the passage areas?
Please, I don't know.
You don't know it can go through your eyes, your nose, and others?
No, please.
Are you aware that you're not supposed to touch your face with your hands, especially when you've not washed it immediately?
No, please. I'm not aware of that.
Scrap dealer Idrisu Mahadu is unaware of confirmation of cases of COVID-19.
We've heard it's in other parts of the world, but not in Ghana. You just informed us.
Idrisu and other colleagues sit under a shed chatting among themselves. Most of them had just returned earlier than usual from daily rounds to scavenge for scrap metals. It is their way of restricting their movement in order to protect themselves. They met on return quite a number of people, though not as many as usual. Discussion centers on the virus and how vulnerable they could be after one of them explained how much they are exposed. Right behind them is a wooden structure. I am told it's a sleeping space for many of them. The structure is poorly lit without windows, so no ventilation. Mats and mattresses are spread on the floor, with other property packed in corners. Mahadi accepts they are largely at risk if the virus should be contracted by one of them.
We can't do much. We have to look to God. We pray it doesn't get here.
The congestion here was worsened by a recent fire that gutted a number of homes here. Now, the few who have been able to rebuild their wooden structures are forced to take in others who are shelterless. At least 8 people now sleep in a room. In this home, rented mainly to headquarters, not less than 100 people live in the 8 rooms. Inside one of the rooms, I find 7 tired-looking women with children who have retired from a day's Kayaye activities, taking a rest. Each has been in contact with several people they have lost track of. Many more are still in the central business districts, going about their businesses. They explain how they have protected themselves in the face of rising cost of hand sanitizers.
Now, apologies, that report was rather the report on the reconstruction of the homes of slum dwellers who've had their homes destroyed by fire. Coming up on Joy News today, Sanitation Ministry and Accra Metropolitan Assembly take advantage of the lockdown to embark on a general cleanup exercise in the Central Business District. More after this breather. Thanks for staying with us. Now, the Ministry of Sanitation and Water Resources, in collaboration with the Accra Metropolitan Assembly, is about to kickstart a massive cleanup exercise in Accra. Over 250 security officers drawn from the Ghana Armed Forces and the Navy, plus an army of Zoomlion staff, have been deployed to carry out the exercise. The ministry is taking advantage of the lockdown period to ensure effective cleaning and cleansing of the city to promote conditions of hygiene in support of the fight against the coronavirus COVID-19. My colleague Parker Wilson has been speaking with the Sanitation Minister on this exercise and joins us live from the ground. Parker, where is the exercise happening now? Right, Parker, where is the exercise happening now? Right, we seem to have hit a snag with the connection with Parker Wilson, but we'll go back to him now and find out how far the exercise has been going. Parker, if you can hear me, where is the exercise happening now?
Well, Daniel, I am currently at Agbabuloshi Market, one of the biggest yam markets here in Accra, and also one of the biggest slums here in Accra. Just behind me is an excavator, as you can see, which is carrying out the exercise, desilting the gutters. And then you know that this exercise is just within Accra and Kumasi, and essentially the Sanitation Ministry is taking advantage of the lockdown period to ensure that they clean the environment before a lot of Ghanaians get back to work, because now there are quite a few people in town, and so they are using that opportunity to do that. We visited a CBD where we saw the military. I mean, I'm talking about the Ghana Armed Forces, the Navy, personnel from the Ghana Prison Service, all with their logistics, rigs, brooms, sweeping and desalting gutters. So clearly the minister is quite confident that this will yield the needed results. And Daniel, when we spoke to the minister earlier, about some few minutes ago, she was confident in her mind and actually cautioned Ghanaians against indiscriminate littering. The minister says that they are going to distribute beans to each household so that they can promote hygiene and sanitation in the country, and is warning that henceforth the assembly, that is the AMA, and all the assemblies in this country will enforce the bylaw. So should any individual violate these, I mean by littering around, the person will face the law squarely. But Daniel, you know, Agbogbloshie, since it's a market area, let me try and speak to a few of the market women who work here and see how this exercise or this initiative is going to help them in their work. And I have with me a woman here. Mommy, good afternoon to you.
Eba mucho munhwe na munye eha ne ye maye se yeso eha ye pa se ye ton ade wo ase eba mami fa kwa man papa fa kwa man eba lisa etiti obi beto ade se ano o kasa se eha ye poto nti ye srem munye ha ye maye se gota no inflama no so ha ye papa nkasa inflama no huba fom nti mo pade na mo hata so maye na han ye cream maye
na ya bomo kwedu se mo na mo boma efini ba ha sa ha ye clean we are then am betimi ya ebeboa se efini bejai
efinu se anopa bia ebefa prae apra ha kama ya siesi ha kama na efi bia emba ha bio.
Okay, thank you. So, Daniel, essentially what she's telling me is that, well, she's excited about this initiative, and that for them, one of the things that worries them is that they don't have any pallets on the gutters, and so the sachet water, the polythene bags, of course, the takeaway packs, all get into it becomes a problem. Sometimes it affects business because when people come around to shop, they complain a lot, so they move away. So they're excited that this is happening, and she has pledged, actually, that going forward, they will try and organize themselves, mobilize themselves to ensure that they clean the environment before they leave. Let me speak to one last person, and then I'll get back to you in the studio. Daniel, madam, good afternoon to you. Hello. Well, Daniel, well, she declined to speak, but essentially here at Agbogbloshie, this is what is happening. So the ministry and the assembly is urging all Ghanaians to abide by the laws and ensure that they clean their environment and promote hygiene conditions in the country.
Parker, the finance minister, I learned, is also participating in this exercise and has been speaking. What has he said exactly?
No, then come again. I didn't hear the question.
I was asking that the finance minister, we were told, has been participating in this exercise. What has he said?
Oh, yes, the finance minister was at the opening ceremony at the AMA headquarters. Now, according to the sanitation minister, Cecilia Blandapa, the finance minister just came through to give words of encouragement. Now, when he was addressing the crowd, the team that has been detailed for this particular exercise, he indicated that the lockdown period is quite challenging for government. In fact, he admitted that it's going to be a difficult time for this government, but however, he is confident of government capabilities to manage the situation. He talked about how government has been able to secure some 35 million from the World Bank, and again the 3 billion euro bond that they secured. All is going to help with how they are going to deal with COVID-19. And then for him, one interesting thing he said, he quoted the Bible that talks about where God said that we will drive the beast away from this country. So for the finance minister, this COVID-19 as a beast in this country, he is confident and hope that God will drive away this virus so that Ghana will get back to a normal, its normal activities, and the economy will get back on track.
Well, thank you very much, Parker Wilson, for that update. You're still live on Joy News Today with me, Daniel Daze. It's time for sports with the man who loves it, Nathaniel Atto. Now, before we go for world news, the Chief Executive Officer of the Ghana Chamber of Bulk Oil Distributors, Senyo Hosi, has donated broomsticks to the multimedia group to aid in the execution of our work in this time of the COVID-19 pandemic. Presenting the items, Senyo Hosi commended the multimedia group's contribution in disseminating information to the general public on the coronavirus pandemic.
On behalf of the Ghana Chamber of Bulk Oil Distributors, we want to present these boom mic poles to you, the multimedia group. One, we absolutely recognize the value of the work you are delivering, and these times are key times for us as a country. While we stay at home, you have to take the risk of contracting this virus just to be able to serve us, share information with us, to keep us up to date with things. In fact, as I said, you guys are the ones keeping the country sane as at now, but you are doing it at the risk of your lives. So these posts are supposed to help you exercise the social distance protocols that are required to protect you. So with this, you should be able to now have your interviews with some 2 meters or 3 meters apart. So wish you all the best. As a country, I believe everybody owes the media a lot of gratitude by the end of this fight, because you are the front line and you are exercising a high-risk job, and we really appreciate what you do. God bless you. On behalf of the Chamber of Bulk Oil Distributors, thank you.
And many thanks to Senyo Hosi, CEO of the Ghana Chamber of Bulk Oil Distributors. The items were received on behalf of the multimedia group by Head of Health Desk, Fred Smith. He expressed our gratitude and acknowledged Mr. Hosi's contribution to the fight against COVID-19.
So we'd like to say a big thank you for thinking about us this way. A lot of the times, because of the way we do our job, we forget that we ourselves are also at risk, and we end up chasing the information ahead of our own safety.
Lives.
And for you to have thought about us this way, we deeply appreciate. We've followed you personally, and we know the contribution you are making towards the fight against the coronavirus. And also the chamber, you've been very supportive to not just the media, but the entire Ghanaian society. So we'll say a big thank you. We urge you to continue doing this, and you also be blessed. Amen.
Stay blessed.